Dr. Volmar Franz. Maybe to start with today, you could give me a little bit of background on how you arrived at INcorporation Therapy in your life. What kind of process did you go through to ultimately develop this approach?
Something was needed in the field to help people who were traumatized.
Mm-hmm.
At the time, there was nothing that would help an individual start, what we call in professionally, to stabilize themselves before
Mm-hmm.
they can move on and do more therapy for themselves. So what I developed is setting up a stabilization process so people could get stabilized enough in order to deal with the trauma without having the impact of the emotions that kept them from dealing with them at the time.
Now, one thing you've talked about in INcorporation Therapy is the stance from which this approach takes within the person, and you have defined it as a revisiting stance as opposed to a reliving stance.
Yes. What we know from all research in the profession is that if an individual remembers and they had no defenses when it originally occurred,
Mm-hmm.
then they've developed no different skills in order to deal with it. They get what we call sucked into the memory. And things like closing their eyes will disconnect them from reality, and they will relive it. And it will have the same impact.
There's the emotional, all the emotions come back up again.
Right, just as when they dealt with it or didn't deal with it in the first place.
And one of the biggest differences in your approach is that the subject that you're working with can actually go back to a traumatic event in their life and recollect it, but without all that emotional impact of reliving it again.
Right, and the process called revisiting. So
Mm-hmm.
they're distanced from that pain, so they have the ability to take back what they lost.
Mm-hmm.
And really what they lost is a part of themselves. Every time an individual goes through a traumatic event, they'll lose a part of themselves.